Hi, everybody. This is Andrea Perry from Huron Valley Chamber, and we've got another seminar for you. Today, I've got Dave McKwen from DMC Huron Valley Sinai Hospital, and he's got a wonderful presentation that we're going to be talking about for a little while. And so, Dave, go ahead.
Thank you, Andrea. And thanks for affording me this opportunity. For most of my career, I've worked closely with chambers of commerce, and I understand the important work that chambers do. You really are the adhesive that keeps a community together and keeps a community focusing on supporting its own. It's awfully important work, and I'm just thrilled to have an opportunity to share some of our information with you. Now, my intent was to share a little bit about the Detroit Medical Center and Huron Valley Sinai Hospital's relationship to the DMC, and more recently, tell a little bit about our own COVID story. Everyone's got a COVID story, so we were in a unique spot, still are, but there were some extraordinary challenges and some extraordinary victories, and I appreciate being given the chance to share our story. So I've never been on the presentation side of Zoom, so bear with me, and as I share my data here. So I've encountered there we go. So the Detroit Medical Center is actually a collection of 8 distinct hospitals, all anchored by a long-standing relationship with the Wayne State University, particularly the School of Medicine and its allied health programs. The Detroit Medical Center was once an independent private hospital system. It's now owned by Tenet Health, who acquired the hospital system from Vanguard, which was another large national health system. And that goes back to 2013. Prior to that, if you remember, the leadership in the city of Detroit identified some opportunities to improve the health system and thought it best to turn the hospital over to a national hospital system. Then it was Vanguard. Tenet eventually acquired Vanguard. And in acquiring the hospital system, also acquired the many promises that were made to the Detroit market when that process started. Our leader is a young woman named Audrey Gregory. Dr. Gregory is, and I love this about her, she is a nurse. She grew up in the Tenet Health system, working as an ER nurse manager, and a director of emergency services and other acute care responsibilities, and quickly ascended into CEO roles at numerous hospitals within the Tenet Health system across the South and Southwest. Tenet is, as I mentioned, a national health system. It represents a collection of about 64 hospitals, as well as a group of surgical facilities, ambulatory surgical facilities, and some support services that are essential for the operation of both. The Detroit Medical Center has earned prominence by a number of national accrediting organizations and centers of excellence, in particular cardiovascular services, women's health, neurosciences, stroke, and orthopedics. Pediatrics, certainly rehabilitation. This is acute rehabilitation that happens in an inpatient setting, and organ transplant. And these programs are even bolstered even more by the presence of the Wayne State University School of Medicine and the residents and fellows that come from that relationship. The Detroit Medical Center's mission is simple: to provide compassionate, high-quality care to the people of Detroit and the communities that we serve, especially to those who are most in need. And that's, for me, a defining uniqueness about the DMC. This is a legacy that goes back to the 1800s, to serve and care for, in a compassionate manner, people that are often at the fringes of the healthcare system who can't afford the services, and that remains a critical part of the mission here. I've been with Huron Valley for a little less than a year, and I can attest to the culture here. It is in large part due to the tenant culture. We are devoted to an environment of accountability and transparency. In fact, Tenet continues to earn national recognition for its commitments to integrity and transparency. But the operative words for DMC and certainly for Huron Valley are compassion, dignity, integrity, kindness, trust, and respect. And we have something here called the DMC way, where we pay close attention to, and we talk regularly about the behaviors that are associated with these values, because we understand that behaviors create values, values create a culture, and culture is what attracts and keeps great people. We've represent a collection of, in total, about 2,000 licensed beds across 8 hospitals. 3,000 physicians are affiliated with the Detroit Medical Center, over 12,000 employees. And just one interesting point in time, the Harper Hospital pioneered the world's first mechanical heart over 50 years ago. It's a really noteworthy point in the history of healthcare technology. Here are some of the organizations that have recognized DMC for its quality and patient safety and a commitment to innovative care. These are impressive designations that are typically earned by much larger health systems, and yet this is happening right here in Southeast Michigan. The organization itself is a relatively flat organization. If this were on an org chart, it would look fairly typical, but when you scale it for the geography that's covered and the number of patients that are served, the number of employees that call this place home, it's really a pretty flat organization, and that's been by design. It's a lean, nimble team that is designed to keep us all very close to the frontline experience, the experience by our colleagues taking care of patients. The top row there is the senior leadership at the system level downtown, and then the hospital CEOs. I mentioned we have 8 hospitals. Karima Bentounsi, second from the left, actually is the CEO over 3 hospitals. 4th, the heart hospital, is embedded in the system. So the 5 CEOs collectively cover 8 distinct hospitals. I should mention, those hospitals are, I hope everyone's heard of Children's Hospital of Michigan, the Heart Hospital, which is a team devoted exclusively to cardiac care, Harper University, Huron Valley, Sinai Detroit Receiving, which is a huge emergency facility, biggest in the state, the Rehab Institute of Michigan, the largest provider of inpatient rehabilitation, and about 40 outpatient settings. They serve over 1,000 patients a day themselves. And of course, Hutzel Women's Hospital, which is attached to Harper, and Sinai Grace, which is in Northwest Detroit. As a health system, we are committed to providing what we refer to as community benefit. Extremely proud of these contributions because they really, for us, represent the broader purpose of a healthcare institution. Not just caring for folks when they're not feeling well, or they're injured, or they've been diagnosed with a disease, but really investing in the health of the community in a way that bends the curve. And a big way that happens is investing in capital, technology, equipment, building, facilities that allow us to advance those frontiers of care. In the last 7 years, Tenet has invested more than $1 billion, much of it right in downtown Detroit, a brand new critical care tower for the Children's Hospital. There's also an extraordinary commitment to the number of other similarly aligned community service agencies in Southeast Michigan, particularly those that represent the diversity of our community. Over almost $250 million spent in those relationships where we try to buy local. And something we refer to as graduate medical education. This is the residency system that medical schools rely on to continue the education of their physicians. In most cases, physicians don't practice unless they've completed a residency program. And these residencies can be 3 to 5 years and are often tag teamed with another 1 to 3 year fellowships for those physicians that want to subspecialize. But DMC's residency training program is the largest in Michigan. On any day, there are over 1,000 residents and fellows in the hallways here in downtown. And that GME commitment costs about $75 million a year, which is partially reimbursed, but certainly not, our costs are not entirely covered. And I'll share a little bit more information about Children's Hospital in a few minutes, but as a member of the Detroit Medical Center, we have 8 siblings, and each has some really unique contributions to the larger system. And of course, being a medical center and a teaching based health system, we were committed to research. The slide here notes over 1,000 research studies in place at any one time. We have calls every 2 weeks where we're approving, reviewing, denying clinical research studies that are happening right here in Southeast Michigan, led by our physicians that are collectively advancing the care that's available here. When Vanguard and subsequently Tenet assumed the ownership of the Detroit Medical Center, it also committed to maintain or fulfill the promises that were made to the community back in 2008 when those transitions in ownership happened. And at the top of that priority list, always a priority for DMC, as I mentioned, is the commitment to care for those who often require support and assistance. You can see our stats there, over $1 billion in uncompensated care, charity care in the last 10 years. Because the Detroit Medical Center has a population that relies significantly on Medicaid for the provision of health services, we actively help people find those benefits and enroll them in the plan so that they can access the continuum of care that they need. The Medicaid program also connects our patients to a incredible network of physicians and residents that are in teaching environments that provide frontline leading edge technology, interestingly, to people who can often afford it the least, which is just an incredible part of our mission. Many of the hospitals within the Detroit Medical Center have been Magnet recognized, which is a national honor society for hospitals for a small exclusive list of hospitals that demonstrate a continuous interest in investing in their culture and developing clinical leaders. So here's one of my favorite siblings. Everyone has a favorite brother or sister, right? So the Detroit Medical Center, Harper Hospital, was founded in 1883. Children's Hospital appeared on the map in 1886. This is not a come lately pipe dream that leadership within the DMC developed recently. It's a long-standing commitment with one purpose, focusing on your child. 228 beds, a level 1 pediatric trauma center. It's verified by the American College of Surgeons, incredibly high standards. level 4 neonatal intensive care unit, which is the most intensive level of care that can be found for pediatric care for newborns and preemies, in addition to a dedicated burn center, something that most facilities have stepped away from. Most hospital systems don't care for this population, yet the needs remain. Over 40 pediatric specialties are present in Children's Hospital. It's the largest pediatric residency program in the state, third largest in the country. 240, 250 pediatric residents and fellows in the hallways, in patient rooms, in offices, in surgeries and ERs every day. And we graduate 70 residents a year. Numerous recognitions from a number of benchmarking organizations around quality and patient experience. I won't go into, you can see the detail there, and some examples of some recent investments at Children's. Interestingly, some don't know that Children's Hospital operates a freestanding emergency department in Troy on 16 Mile, which extends those services, the caliber of services that are available downtown to the suburbs. Huron Valley Hospital has numerous pediatricians and pediatric subspecialists that have office hours here. So again, we connect these communities in the suburbs with the specialists that are available downtown. That's an important part of our mission. So now taking a look more closely at Huron Valley Sinai Hospital. A small, very nimble leadership team. In a few days, we'll be onboarding our new legal and regulatory compliance officer. But you can see my high school yearbook picture there. Our CNO is a woman named Sherry Underwood. She's an amazing leader, frontline nurse in her early days, and she's in many cases assumed system-wide responsibility for certain nursing functions as well. Catherine Gary is our Director of Strategy. Dan is a CPA, he's our Chief Financial Officer. Allison Damaris is our Chief Human Resource Officer, and making sure that we pay close attention to our employment culture and our levels of engagement with our colleagues at Huron Valley. Hospital was built in 1986, serving western and northwestern Oakland counties. Interestingly, this hospital has earned a straight A from the Leapfrog group twice a year for the last 8 years. There's only one other health system in Michigan that's done that, and that's the University of Michigan. The Leapfrog group is a collection of, excuse me, of large employers, General Electric, the big three, national purchasers of healthcare who take a very close interest in quality, cost, efficacy, productivity, innovation at its hospitals. And it creates, again, another honor roll for hospitals that can measure up to their standards. And we've done so consistently, I think, for 17 report card periods. Huron Valley Hospital has had its own trophy case, numerous distinctions for our Harris Women's Center, the Chair Cancer Center, an impressively deep investment in robotic surgery, both for general surgery and cardiovascular and orthopedic cases. We have 2 surgical robots on site, soon to have a third. Very unusual for a hospital this size to have this deep of investment in this kind of technology. Some other trophies from our trophy case, similar distinctions from national organizations that are earned by this community hospital. So my sense was, when Andrea approached me, that everyone has their COVID story, and ours is an extraordinary one, and it continues. I arrived here in mid-March, just as at the beginning of the surge, and I was impressed to be a part of a very immediate, rapid transition to what we thought would be a short-lived emergency. It didn't turn out that way. COVID is something, as you know, that we're all living with. It's a background level of activity that we have to pay close attention to. We're not experiencing the surge in Southeast Michigan that we did in the spring. Other parts of the state and country are. But in the spring, we immediately mobilized, created an emergency management center and connected to regional other area hospitals, as well as our downtown facilities. We networked among physicians and care teams. We redeployed our space, redesigned it, organized physician teams. The physicians that were amazing in this process. They got together, they segmented themselves. We had pulmonologists and critical care and infectious disease and internal medicine. Residents stepped in. They created a physician team that triaged patients based on their symptoms and the care demands that they had. And they rotated those responsibilities because it was a tiresome, amazing commitment to provide care for those roughly 10 weeks. Of course, we connected with the Centers for Disease Control, the state of Michigan, the local Homeland Security regions, the health departments. We were sharing information on a daily basis, connecting to vendors, some creative relationships to ensure supply chain integrity. And what we didn't expect was the community response. It was just an extraordinary, heartfelt experience to see how our neighbors, friends, folks we didn't know, trustees, physicians, come out of the woodwork to ask what we needed and offer to help. Our volunteer coordinator, who historically manages dozens of volunteers who are here every day, her principal role became managing the relationships with hundreds of organizations and people who wanted to give things to the hospital. It was just an amazing time. There were drive-by solidarity parades, emergency medicine, and other communities. Safety workers came together to make sure everyone was okay. We created drive-up testing sites to expand access to testing at a time when testing technology and the reagents and turnaround were lacking. But I'll just walk you through a couple phases. The first identifiable case occurred in March, although we know now that COVID-19 was probably in our community back in the fall of 2019. Initially, there was a huge volume of very sick patients. Most required eventually mechanical ventilation. Hospitals like ours, we postponed outpatient and elective cases, really shut down and just became an emergency department with a large hospital attached to it. And we had those challenges that other hospitals experience with the loss of workforce due to exposure. We were learning about PPE and the appropriate precautions to take. There were some supply chain problems initially when this surge in demand occurred. We got very innovative and benefited from employers in the community who were sharing their cleaning products and N95 masks and face shields and goggles. And we were privileged and grateful to use anything and everything that came through our doors. Eventually that supply chain leveled out and we had reliable levels of PPE and supplies.
So Dave, I have a quick question.
Yes.
So I pretty much guarantee my daughter had COVID back in November.
Yeah.
She was down for the count for 10 days, had all the symptoms. We took her to the doctor probably 4 times trying to figure out what the heck was going on. And they just kept saying it's a virus, it's a virus. And, you know, luckily she recovered. But I mean, what do you think about it? Again, it was not ever diagnosed as COVID, but I mean, what do you think about that situation?
Well, I suppose now's the time for the disclaimer. I'm not a doctor. I'm not an
Right.
epidemiologist. But I was so privileged to hang around with all of them while this
Right.
was happening. And I think the understanding now is that the virus was here in Michigan, in the States, you know, well back into 2019.
Right.
And, you know, for a long time wasn't isolated as a distinct cause of anything. But it was, you know, often seen in people who already had some health challenges,
Mm-hmm.
some respiratory compromise, COPD or heart failure, congestive heart failure, history of stroke, diabetes, obesity. Those are all risk factors that decrease a person's reserve. And a
Right.
virus like this comes along, whether it's a flu or COVID, and it's just enough to tip them. There were a number of people who look back at last fall, kids, parents, who now recognize those symptoms.
Mm-hmm. Exactly. Yeah.
Unfortunately, a lot of people toughed it out.
Yeah. I'm very thankful that she didn't have to be hospitalized, but if she did, I would be coming to you.
Oh, thank you. Well, it was just an amazing time, and it was a window into watching how evidence-based care evolved quickly from day to day, from every 8 hours. Physicians, respiratory therapists, nurses, even in environmental services, housekeeper personnel would come together and say, this isn't working, but this did. So let's all do this for a while. And that became the new standard. And then the DMC, part of, you know, being an 8-hospital system, we were on the phone twice a day with each other, sharing experiences, what was working, what workarounds did we find, how to conserve PPE, those eureka moments that get discovered. And being part of Tenet, who is also, you know, on a national scale going through similar surges in different markets, it was an amazing, invaluable opportunity to learn from others and share quickly. So how we care for these patients evolved rapidly. We found alternatives to mechanical ventilators. We found alternatives to the drug regimens that were first being used. And now we're finding many people who never had COVID have antibodies for COVID, which, you know, suggests that they were exposed a long time ago
Mm-hmm.
and never got sick enough to go to the hospital, and develop some immunity, passive. So it's been a fascinating virus, and I understand from our physicians there's going to be a scientific analysis for years based on what we encountered in the last 8 months. I'll flip back to my slides and I share a little bit more about our experiences. I mentioned we took a quick look at how we were using our space, and we repurposed a lot of our real estate to provide care for not just our patients, but our employees and our physicians, and tried to create safe space for patients with COVID, patients without COVID, patients that were being evaluated for COVID. And then we, you know, connected on broader levels. Dr. Gregory, our system CMO, you know, she assumed a role where she was connecting with state and national leaders. There was relief opportunities and some efforts from hospital associations and health departments and CDC and Red Cross. She was in that spot where she was connecting us with other health systems, sharing our experiences, pressing for improved supply chain support. But she was also our cheerleader. She reminded us of our successes and communicated those successes from hospital to hospital. So, looking back, the physician leadership and the level of engagement of our employees was just amazing. And for someone who had just recently arrived at Huron Valley, it was an extraordinary time to see people do what they were called to do, the work that really energized them. It was at times scary, uncertain, but everyone knew at Huron Valley that there was 1,000 employees that were ready to help. That level of collegiality and resilience really created some ingenious solutions that helped our patients. Here's a couple of photographs of what this place looked like in March and April. There was plastic everywhere. We were redefining or redesigning care procedures to minimize exposure to our staff, to preserve PPE, to create safe zones for the care of other patients. We still had an ER that was very busy. And as I said, the level of community support was amazing. We had over 70 local organizations donate 10,000 meals. One organization bought flowers for all the mothers at Huron Valley and helped us figure out a way to identify the moms, recognize them on Mother's Day, morning, noon, and night. Godiva Chocolates delivered a refrigerator-sized box of chocolates that evaporated very quickly. Knights of Columbus fed all of our employees for 24/7. Just an amazing response from our friends and neighbors. And then in the middle of this, we celebrated Hospital Week, where we pat our colleagues on the back and try to take a few minutes and show our appreciation for each other. There was a Hospital Week and Nursing Week, and all sort of coincided at the same time. And so now we're in the fall, and there's been a resurgence, as everyone knows. It's different. The acuity in general is lower. Patients are not being placed on ventilators as often, dramatically less use. There's different drug regimens available. Patients are going home faster. Some have suggested that there's been 2 or 3 or 4 different mutations of the virus since the springtime. But what we do know is this is real. While the news cameras don't have routine access into what's happening behind hospital walls, this is a serious public health crisis, and it remains that. There are hospital employees and physicians that are continuing to come to work 12, 14, 16-hour shifts, wearing the most protective PPE so that they can continue to care for these patients. The conversation around managing exposures, it needs to be a serious conversation. I think we, like most hospitals, have between 5 and 10% of our workforce that's quarantined. Not because of an exposure from a patient, but exposure in the community, or someone who was in the community that came in and visited somebody. And that is not entirely avoidable, but it's largely preventable by simply wearing a mask. I won't lecture on that point. We all understand the opportunities to decrease this spread. It's just where we're living right now. And for hospitals, at least in Southeast Michigan, some hospitals are surging again. Not at the volumes that we saw in the springtime, but the precautions are familiar to us. They're standard of care, and we just hope the community respects the guidance that's been provided, so that they can minimize their exposure, minimize their chance of getting sick, minimizing their need to be in the hospital. And the no-fail strategies here are especially reminding people to monitor their own health for your own sake, for the sake of your family. If you exhibit symptoms, isolate yourself, call your physician, go to the hospital. Don't put off taking care of yourself. We saw some dramatic examples of that happening in the springtime that could have been avoided had someone just called their physician, just go into the emergency room. The emergency rooms are safe. The hospitals, this hospital, DMC, has created safe zones, COVID care zones. We've segregated traffic patterns. We've got tight limitations on visitation, plenty of PPE. We doubled and reinvented cleaning and sanitation practices. There should be no reason that someone puts off their own care, I hope. If you don't have a doctor, get one. It's easy to find a physician on dmc.org. It's so important. A primary care physician, a family doc, can play such an essential, vital role in helping us stay healthy and interpret opinions from the specialists that we all eventually need. It's probably the single best thing a person can do to maintain their health, connecting and staying connected with a family physician and paying attention to your own health. So that's my ask. And if we do this, COVID, I think, will become a much less preoccupation for us, and we can all look forward to things returning to a relatively normal state. I really appreciate the opportunity to share this information with people. Part of my job is very fulfilling, is maintaining relationships with the communities that we serve. I look forward to connecting and engaging with people that have an opinion of this hospital, that have an opinion of DMC, good, bad, opportunities to improve. That dialogue is what allows us to be better. So sharing my contact information, I look forward to hearing from people who couldn't be part of the presentation, and I'll unshare. And
yeah, Dave, I do have to say, it was a very, very informative presentation. Thank you very much. There was a lot that I kept nodding because I'm like, yep, let's do that. Yep, yep. So it's very important that you reiterate or continue to reiterate what is going to keep us safe and healthy. Having a teacher and a student and kids who work out of the home, it's very important that, and I work out of the home usually. It's very important that we do stay safe. And the fact that what you guys are doing at DMC Huron Valley Sinai is fantastic. It's very, very cool. And I really enjoyed, again, the presentation. It was great.
Thank you. If nothing else, I hope I've helped people rediscover this gem that we have in Commerce Township.
Yeah, yeah, yep. I think I had my daughter at the Harris Birthing Center. It was brand new. And so I'm like, oh my gosh, my own room? That's awesome.
Yeah. And it still looks brand new. It's a
awesome, very cool. Yeah, well, I really appreciate this little gem that we have. We're very blessed to have Huron Valley Hospital on Commerce Road. So it's very cool.
All right. Well, thanks for the opportunity, Andrea.
Yep. Thank you, Dave.